talk about artificial intelligence and your health and medicine. Perhaps they are a perfect match. Perhaps they're not. There's a new survey out from Liaison Strategies. Ask Canadians how they felt about using AI when they access healthcare. Get a load of this. Just under half of Canadians have used an AI chatbot for medical advice in the past year. 42% are comfortable with AI screening them before a doctor does. Now, of course, there's questions about accuracy and more. Let's go to Dr. Michael Kalin, a family physician at the Kildare Santé Clinic in Côte-St-Luc. Dr. Kalin, welcome to the program.
Thank you for having me.
I don't know if you looked at the top of line numbers here, but what's your reaction to Canadians using AI when it comes to their health and maybe some hesitance on relying on artificial intelligence? What are your thoughts?
Well, I'm not surprised. It's a great new frontier, and certainly patients have historically looked for answers on their own, whether in the past asking family and friends or more recently Googling their own symptoms to look for maybe some hints or clues to help in their own care. So I think this is a natural progression to go to AI and AI chat boxes, and I welcome it.
So, I'll tell you from my personal experience, I always found Googling, like old school Googling, not how Google is today where it's an AI result anyways, but like before when I would just Google something medical wise, I thought it would always lead me down rabbit holes and not the right answer, and it did more harm than good. I will say that, now these actual chat bots that have been programmed on virtually every medical text of all time, it seems, I'm getting proper information. And I don't want to say it's perfect, but it's actually, I find it's useful. It's helping me when I get to a doctor. I wonder if you feel the same way, or would you be tapping the brakes a little bit more?
I agree. We used to joke that everybody had lupus or Lyme disease in the past, and certainly we all were concerned people were going to get cancer. And I feel that with the AI now, the answers are much better. Patients can put in their symptoms. There can be a conversation, and maybe it can help narrow down the symptoms. But there are limits, and I think the survey does reflect this, that as much as people are interested in getting more information, they really want to review it with a professional. And in the survey, the majority of people would wait up to 2 weeks to see a doctor to review their symptoms. And I think that's reassuring, because I think that's where this works best, is when people use the AI chat box with their doctor or their nurse practitioner, where they can discuss it together. And I think there's a lot of value to that.
I'm so happy you highlighted that part of this survey here. So the Canadians were asked, what would you take here, a 2-week human doctor wait versus immediate AI diagnosis? 68% said, I'll wait the 2 weeks for a human doctor. 27% opted with the immediate AI diagnosis. I guess I need to ask you, how are you using artificial intelligence in your practice right now, in your day-to-day, doctor?
Well, I use it 3 ways. First of all, AI scribes have really come onto the scene. And this is where a patient will come in and our system will listen to the conversation and then generate a note that's supposed to be concise and accurate. And this is really to allow the doctor the opportunity to have eye contact, that beautiful thing that we've lost with computers with the patient. And it seems like we're looking at a screen, not at our patients anymore. So the AI scribe has really come on the scene. We're also using it in what's called a prehistory chat box, where patients will get a link to the chat box before their interview, where symptoms can be reviewed, and a note is generated for the doctor. And one of the things I really appreciate about this is that it will ask the patient, what are your expectations of the meeting? And sometimes it's not so obvious. And it's nice that the doctor is aware of this beforehand and maybe gives us a little head start on some of the issues that are important. However, this is very time-consuming for the patient, and I can often see that there'll be over 80 messages going back and forth, and the patient can be involved in this process for 15, 20 minutes. And finally, there are some outstanding AI resources for doctors. One of the most famous one is called Open Evidence, using the New England Journal of Medicine, the Journal of the American Medical Association, and it allows us to put in symptoms and results, and using this database, this vast knowledge, can help us narrow down some conditions. So it's something that we would never use in place of our clinical judgment, but we can use it together with it.
We're with Dr. Michael Kalin from the Kildare Santé Clinic in Côte-St-Luc. We're talking about the use of artificial intelligence in medicine right now. Long-term, Dr. Kalin, do you think we'll end up in a spot where everyone's got more than one doctor? They've got their doctor that they go see, their family physician, but along with that doctor comes the knowledge of every doctor of all time. Do you think that's where we're headed?
Well, perhaps, and certainly the government, they want to get an integrated, health records where, we're not working in silos anymore, where the notes in my clinic will be shared with doctors anywhere else in the province, and perhaps that's a good thing. But we can't forget issues like privacy, security, accountability, right? We're always worried that our information can be hacked, it can be lost, or maybe even sold to corporations. And this is a fear that I think a lot of us have, that it's intriguing, it's exciting, but then there's always that ominous side, which is what is being done with this information? Who has access to it? Who's looking at it? Mm-hmm. And I think that this is a little bit unnerving when we stop and we think about it.
Doctor, humans make mistakes. Human doctors make mistakes. Of course, AI is making mistakes. We see it all the time. So how do you tackle, or what do you think the best way forward is in dealing with the mistakes that invariably will happen? How do you guard against mistakes when you've got the intelligence that these systems provide?
Great point. And that's where it comes down to, which is accountability. Who is responsible for the diagnosis, for the treatment? And if somebody goes to an AI and the AI makes the diagnosis and gives the treatment and it's the wrong one and the patient does poorly, is it the company? Is it the patient? Who's responsible? So there has to be, in my mind, a human component. It has to go together. That doesn't mean that this doesn't have a big part to play. I think AI is the future, but we need to use it with our skill set. Somebody needs to review it. I think that's true not just in medicine and healthcare, but in many other areas where AI is exploding, where we really want a little extra oversight of this and to use the human touch, the interaction, and together we'll get the best results. Let's not forget, as of right now, AI cannot examine you.
Yeah, for sure. Dr. Kalin, listen, we'll have to leave it there. You have a fantastic weekend. Thanks for hopping on.
Have a wonderful day. Thank
Dr. Michael Kalin right there, family physician at Kildare Santé in Côte-St-Luc.
iHeartRadio is throwing it back.
2010s, the decade.
To the days of huge hits and unforgettable anthems. A non-stop stream of the biggest and best.
Drake, Rihanna, Beyonce, Katy, Gaga, The Weeknd.
And more. All your decade-defining favorites all in one place.
Hi, it's Katy Perry.
Hey, it's Bruno Mars.
This is Kesha.
Find 2010's The Decade on the free iHeartRadio app. Preset the station so it's always one tap away.